please.
Okay. Let's see, this should work. Oh no, okay. All right. All right, everybody. Thank you so much for being here. Thank you, Cassie, for that great introduction. I appreciate you. I appreciate also the opportunity of working with all of my Naval Academy compadres, Beat Navy, within this Survivor Advocacy Network. As we say, there's one or several days of the year when we're competitors, but in this space, we are all aligned. So let's get started. We're going to talk about talk therapy, psychotherapy, how to make it work for you in this space. We had a little introduction. I'm going to introduce myself again, and then we're going to talk about what our expectations and goals are in this space. We're going to talk about what is talk therapy, who's qualified to provide it, the types of talk therapy you could experience, how and where to find a therapist, getting the most out of your therapy experience, and also what if it's just not working? Just things that we can do there. So we're going to have some poll questions in between that we'd appreciate you all, just to make sure everybody's still with us, as well as a few videos that we're going to experience. So you're going to have different learning sources that basically are stacking what we're trying to explain here. And for those of you who have been in therapy before, and this may feel a little basic, understand what we are trying to do here is basically make this a safe space so that people understand that you can do this and do something else. So we just want to ensure that it's a safe space and people understand that there are different ways that you can approach the therapy experience and how you can get the most out of it, especially as a sexual assault survivor. So who am I? As Cassie stated, I am the West Point class of 1984. One of my classmates, Suzanne Hickey, she gave each one of us in our class one of these cute little, it's a woman, Rizzy the Riveter, but it has, at the bottom of it, she did the research. And so she identified that I am the 311th female graduate of the United States Military Academy, and I am the 12th Black female graduate of the United States Military Academy. So that's kind of my start of my professional career, right? However, I'm a sister, I'm a mother, I'm a wife, I'm a friend, I'm a mama of some pets, I'm a grandmother, traveler, I'm a mentor. I mentor people who are other than military academy grads, and I had the pleasure of doing the commissioning ceremony during COVID for this wonderful young lady who was played tennis at the Naval Academy. And I'm a triathlete. What happened to my screen? Did my screen disappear? It did. I think I'm having some technical issues, so we're gonna keep working with it.
It's working now.
I'm sharing for you, Beverly.
Sharing for me? Okay, cool.
Just tell me when to go ahead.
Okay, so if you're doing that, so did you take me out of share then, so I know not to touch my screens? All right, so let me make this bigger so I can see it.
Yes, I took you out of share.
Okay, so you can go to the next slide. You're going to put it in slideshow. There you go. Yeah, it's there. Did it click? Okay, don't worry. All right, so let's go to the next slide. All right. So what is therapy? The definition, the book definition is that it's a treatment aimed at helping someone, an individual, couple, or group to identify and change emotions, thoughts, and behaviors that are interfering with quality of life. It's administered by a licensed mental health professional with an advanced degree and a license to practice in the state where you reside. Why is this important? Licensure is important because it helps keep the therapist honest. as far as where they can, where they can practice. And it also helps you stay honest with what is available and the services that are available in your particular state. That YouTube link should work. It doesn't. I can. Holly, can you click on that link and see if it doesn't work? I can.
I'm clicking.
Don't worry about it. If it's not working, don't worry. I'm not going to stress out about it.
Oh, something's happening.
It may take a minute.
Is that what you wanted?
I can't see. Don't worry about it. Just push the poll question. We'll just push the poll question. Did we have the poll question ready?
Linda's bringing up the poll.
Okay. And then
talking to a qualified
what
mental health challenges such as depression and
you allow me to share my screen, then I can. Did you do the poll already?
The poll is up right now. We've got several responses. So some people are seeing it, some are not.
Okay. All right. I can't see it. So if you could just tell me what it says, then I can, what the results are, then I can, you can stop it and then tell me what the results are.
Okay. Have we had enough time for the poll?
I think so.
Okay.
Okay, so the poll was on a scale of 1 to 4, how effective has talk therapy been in helping you to manage your life challenges? It's mixed, right? The results are definitely mixed. 30% say very effective. 26% said somewhat effective, slightly. Somebody said not at all. And there's some who said I've not been in talk therapy. So that's perfectly fine. All of those are true. And this is one of the reasons why we want to talk about it, because there are ways, and maybe your experience with your current therapist just is not a good one. And we need to talk about how we can change that so we can advocate more for ourselves during this experience. So if you allow me to share my screen, I can pull up what I can do is if you allow me to share my screen, I can pull up the videos. And then when we stop, if something happens again, then you can pull my slides back in.
Okay.
All right.
There you go.
Thank you, ma'am. And I thank each one of you for being patient. As we all know, we're all learning in this Zoom environment. All right, so.
anxiety. Therapist is one way to deal with mental health challenges such as depression and anxiety. Also known as psychotherapy, talk therapy can help people identify and change harmful thinking and behaviors. But did you know that psychotherapy can actually produce changes in the brain? Those changes can be detected with imaging techniques like functional magnetic resonance imaging, or fMRI, which measures brain activity. In people with depression, psychotherapy has been shown to reduce activity in areas of the brain linked to sadness and depression, like the amygdala, which controls fear and emotion, the hippocampus, which regulates emotions and memory, and the medial prefrontal cortex, which controls high-level thinking and problem solving. Therapy might even change the shape of your brain, which is far more flexible than we once thought. In people with social anxiety, taking an online psychotherapy course was shown to result in fewer symptoms, along with reduced volume in the amygdala, the part of the brain linked to fear. People with a larger amygdala tend to have more anxiety. Medications such as antidepressants also affect the brain, but in a different way than psychotherapy. A combination of the two can be especially effective for certain conditions. Think of psychotherapy like strength training for your brain. The more of it you do, the tougher and more resilient your brain will become, and the better you'll be able to work through your problems.
Okay. So one of the things, all right, here we go. All right, so one of the things that we talked about in here in the video was what I like to call the strength training for your brain. So as we continue to work through, sorry, I have a tendency to click too fast. As we continue to work through some of these slides, I want you to just think about how this is potentially something that can be very supportive and very helpful for you. So when we talk about therapists, there are several different types, right? So you have a clinical psychologist and you have psychiatrists. Both of these individuals work in conjunction with mental health professionals, or we call therapists, and they make diagnoses, usually for more severe challenges, diagnostic challenges. So if you know someone who says they're schizophrenic or they're bipolar, a lot of the different attention deficit, hyperactivity disorders, some of those, things, those have to be clinically tested, and that the clinical test comes from a psychologist or a psychiatrist. School psychologists are specifically trained to work with school staff in a school setting. However, if you have worked in the public school system recently, you will notice that at most you have a guidance counselor. You may have a school psychologist at the higher level, but within a school, it's usually a guidance counselor. Then you have clinical social workers. Social workers can provide therapy if they have their master's in therapy. You have mental health counselors, licensed. There's different titles, so each state has a different title for it. So you could be a licensed professional counselor, a licensed clinical professional counselor. That it just depends on what state you are. The issue is what is the credentialing process. We also have nurse psychotherapists, you have marriage and family therapists, and then you have pastoral counselors. The caution with pastoral counseling is this: your pastor or whoever's on your pastor's staff as the counselor may or may not have therapy training. Now, they may be trained in the religion, but they may not be trained in the therapy. So in the practice of therapy. And so you want to, see if there's something the challenge here is that if there is something that you're struggling with, that you may feel some type of shame around, or maybe it's just not what the teachings of your church are, this is where you may want to step outside of the church to get a therapist. It doesn't mean that your therapist is going to go against your religious beliefs. What you want to do is find out if your therapist is open and if your therapist is willing to understand what you're bringing to the table with regard to your religious belief. And if you have no religious belief, if you identify as atheist, that's fine too, but just let your therapist know so that they know how to work with you, and so that your therapist is not offensive or says something that may be offensive to you in the context of the therapy space. I have an asterisk here for life coaches. Life coaches, executive coaches, period. Many do not have mental health training, and therefore they are not equipped to diagnose or treat mental health conditions. Your coach is there to help you to identify goals and things you want to achieve. And it may feel similar to counseling, but it's not counseling. The counselor tries to get you to dig a little deeper to find out where that resistance is coming from, whereas your coach may work on you on the resistance, but they may not dig deeper. So if that it may or may not make sense, but if you have any questions, just let me know. So then we have different types of therapy. So the type of therapy that I practice is called cognitive behavior therapy. Majority of clinical counselors utilize this. Basically what it is it's talk therapy. We're going to talk about what's going on. The goal is to try to get you to think differently about your situation. You may think that your situation is A plus B and it's C all day, but it could be A, B, D, E, and then it can be something else. So what we want to do is get your brain to think differently. Dialectical behavior therapy is really something that is also utilized in the clinical room, but it's usually used for clients who have more severe mental health disorders, or people who might be on a spectrum or borderline, have a personality disorder, or they are just really in a major depressive state. And the dialectical behavior therapy is more structured and organized to help them to kind of structure their thoughts to get back to a point where they can then go back into a talk therapy type of situation. Eye movement desensitization and reprocessing. This is a specialty. This is a specialty that once a therapist has this particular specialty under their belt, this is a major therapy process used with people who have experienced severe trauma. And it is basically working with utilizing your eyes and how we basically see things. But this is not my specialty area. However, I have experienced it, and it did help alleviate some of my trauma. We also have exposure therapy. This is usually, exposure therapy is like if you have someone who is has a fear of flying or fear of leaving their home or any type of fear of something. It's basically how do we slowly expose them so that they can get to changing, working with the fear or sometime and getting past it. Then there's interpersonal therapy, mindfulness-based cognitive therapy. An example of this mindfulness-based therapy is one of the things I use with some of my clients is I'll ask them to take a walk. And a lot of times, if you think about it, if you're on a walk, got your headphones on, you're listening to music, or if you take a walk, you're thinking about a problem and you're trying to fix something. A mindfulness-based walk is a walk where you would take a walk, but all you're going to do is look for a specific color or look for a specific smell, or identify how many things you can smell on your walk. And you'll be amazed at how many things you can smell just by knowing that your goal for this walk is to identify how many different smells you can smell. There's exhaust there. You can smell water if you're thinking about it. You can smell grass. You can smell flowers. You can maybe smell paint. Maybe there's something else that's going on. Maybe somebody's barbecuing. I'm always like, every time I go somewhere and I smell barbecue, I'm always like looking for it. And I'm like, oh my God, it's going to be some amazing barbecue. And my hope and prayer is that when I find out where that barbecue is, that it tastes the same way that it smells. And sometimes it's great, sometimes it's not. But that is what we call a mindfulness-based walk, is that I am walking, focusing on a smell, but I'm seeing something other than my problem. How does that help me? That helps me because it takes my mind off of the major problem and it allows me to let it go for a little bit so that I can just be in a different space. And that then allows my brain to help me problem solve, or it gives me space away from it enough that it doesn't mean it's got that much pressure on me anymore. So that's just it's a therapy. Some people base their entire practice on it. It's just one tool in our toolbox. Then we have sex therapy, art therapy, music, etc. So there are all different types of therapy that can be used in the therapy environment. And this is some of the things that if you're getting stuck with your therapy space, you may want to just like, okay, what can we do next? Or is there something else we can try? So, can we go ahead and post the next poll? If you can see the poll, you can respond. How we doing, Linda? Did we get it? How we doing responses?
Yeah, we've got quite a few respondents,
Okay.
over 20.
All right. You can close the poll.
Okay.
Okay. So the majority of you say you prefer in person. I'm with the majority. However, there's some who prefer using an app. There are a few who said they're not sure. And then of course, there are the few who have not been in therapy, and that's fine. So let's talk about it. Traditional talk therapy has usually been in person, which means I come to someone's office and I sit in a room, maybe you sit on a sofa, another chair, whatever, and we talk face to face. There's group counseling also, and then there's support groups. In 2020, COVID hit. So majority of what we technically call in-person therapy is now done, what we're doing right now, by video. So we have video telehealth, which basically it's a convenience, because now I don't have to get in my car and drive to an office. I don't have to spend the time it would take me to drive there, be in my car, be there, and then drive back home. It's accessibility, and there's comfort in, just doing it from your home. The challenges with the telehealth delivery is this. All I see of you when I'm a therapist and I'm doing this one-on-one is you from your neck up or waist up. That's all I see. Whereas when I'm in my office and I'm sitting on a sofa with you, I see everything. I see your hands shaking. I see your feet shaking. I see your body tense up. And so there are different things that we as clinicians have had to learn how to look for through the video presentation. We can have the methods of delivery with individuals and or couples. One of the challenges that I have had in some instances is safety. Usually I ask my clients to make sure that they're in a space where they can safely speak to me about what their issues may be. I'm very concerned in the fact that if I'm working with a couple and it's not a good situation, what happens when that screen goes off? Just as if they were in my office and I was concerned about what happens when they walk out of the therapy room. So, but those are some of the challenges. The other method of delivery, you have the apps. They're Talkspace, BetterHelp, Cerebral, Ginger, Doctor on Demand, whatever. There's several different platforms out here that offer clinical support. Especially if you are unable to find someone in your area. I know I've worked on BetterHelp and on Talkspace, and I've treated people who live in New York. I have treated some people from California because there's reciprocity agreements with those states on those platforms. I've also treated people who were international, internationally based on those platforms. So these are also areas where you can be seen, and the person who you're talking to is a real therapist. So that's, those are the things. As far as the apps are concerned, now we have ChatGPT. You type something in ChatGPT and it'll give you some answers. I'm not sure you're getting the answer that you may want, and there is no one there who's kind of helping you to walk through that. So that may be an issue. There are other things, Breeze, a CBT thought diary. There are other apps that are out there that are nice to have, that if you have a need to like journal or things like that, those apps are absolutely wonderful. The nice thing about the Talkspace and BetterHelp platforms is that you can, if you're like a texter and you want to do everything by text, you can do it that way. You can do a whole therapy appointment by text. I've done that before. It takes a little bit of training to read through emotions with text. And you do have to ask a few more detailed questions. But if that's the space that you're in and you don't want to have a physical, you don't want anybody to see you in that moment, you can chat it, or you can have a video call using these apps. I don't do chat with my in-person clients. It's just something that I'm kind of resistant to, but it's an option that's out there. How do you choose a therapist? One of the things you want to do when you're choosing a therapist is, first of all, identify what you're struggling with. It's easier for the therapist if you kind of have some idea what's going on, but you don't have to be able to pinpoint it. You can just call someone, and if you're identify, look, I'm struggling. I've been depressed. I'm not able to get out of bed. We can work with you and figure it out. But if you have things like alcoholism or sexual trauma, if you're dealing with grief, you may want to work with someone who is comfortable in those areas. Not everyone is comfortable dealing with someone who has an alcohol issue. Not every therapist is comfortable talking about sex or sex trauma. And not every therapist is comfortable working with grief. So this is where we may have some challenges in your therapy experience. Also, what's your comfort level? Do you want someone who looks like you, who is the same race, the same sex, religion, potentially? What I caution people on is that sometimes, because when I first started this, I was like, how is this single girl who's only 20-something years old going to help me through a marriage challenge, right? Never been married. How are you going to help me? And I had an attitude about things because therapists are supposed to get therapy. And what I found was that this young lady who I had been matched with in my therapy program was really, really good at listening. And her ability to really listen and find the underlying, to ask the question about what I wasn't saying, was actually helpful for me. So I was very able to get out of my judgment zone, and working with her actually helped me quite a bit on doing some things that helped me do some healing for myself that actually then ended up helping me to heal within my marriage. You can interview a therapist. I'm going to show you guys a video, but in the video, it shows you like going to the therapy office and just getting your thing out. Now you can call and ask for a 15-minute interview. You can ask the therapist if you have 15 minutes to talk to them. And while 15 minutes may not sound like a lot, it may be enough to make you feel like, you know what, I think I could work with this person, or at least give them a shot. The challenge when you're working with sexual trauma or healing, trying to get some healing from sexual assault, is many of us do not want to repeat this story. And so that could be the challenge in all of that. So sometimes an interview is worthwhile. Cost. There are some therapists who will not accept insurance. There's some insurances who do not give you the opportunity to see outside of your insurance to see a therapist. And you may have to be put on a major wait list, and then you're paying out of pocket. Out of pocket costs can be astronomical. Work with your clinician. Many times we will work with clients who, they're like, I can't afford it. I really want to work with you, but I just can't afford it. Is there a way for me to do it? And so, I have a couple clients that I see maybe once a month. I just give them different types of homework to do in the meantime, and we may text periodically, but they cannot afford their insurance. The way their insurance is set up, and this is a very annoying thing for me as a clinician, is that I can't accept, I mean, I can accept everybody who has Blue Cross Blue Shield, but it doesn't mean that your particular Blue Cross Blue Shield plan is the same as my Blue Cross Blue Shield plan. And so you may have a high deductible. And if you find out you have a high deductible and you've been coming to see me 4 times, you know, you see me 4 times in a month and your insurance doesn't pay, you're almost out $1,000. And that, I think that I'm not going to get on my insurance soapbox, but that can be astronomical, and that can be a hindrance in the therapeutic process. Then you have to decide if you want to do individual therapy or group therapy. A lot of times when you're dealing with grief, loss of a spouse, loss of a child, it may be beneficial to do a group. When I worked with people who have been victims of crime, we had some different groups for some young adults, and that actually helped them to process their pain over, you know, being assaulted or, you know, having something stolen from them on the street or whatever that was, whatever issue they were dealing with. It sometimes helped to be in a group of someone else who had the same experience. It's up to you to decide how you want to do that. So can we launch the poll, please? Okay, we can close the poll. Okay, so the majority of you stated that other issues were more challenging than insurance. I respect that. I get it. Then you know, those who have found a therapist didn't find it challenging at all, and then some found it very challenging. So, like I said, everybody has their own experience. We just want to make sure that, you know, we're here to be helpful. So where do you find a therapist? The easiest way to find a therapist right now is, especially someone, many of us advertise on Psychology Today and psychologytoday.com. The reason why I like it is because you can narrow your therapist down. You can put your insurance in there. You can put the sex of the therapist, the race of the therapist. You can put religion in there. You can put, you know, if you want somebody who's LGBTQ plus, that you can put that in there. You can put down what your issue is, like if it's alcoholism, if it's you need sex therapy, if it's whatever you're dealing with, you can narrow it so much that Psychology Today will then produce a list in your state of clinicians who you can then reach out to say, okay, you know, I am dealing with X and I would like to, you know, make an appointment. Now, what I will say to you, don't be turned off when they are like, people say, I have a wait list. I have a wait list. However, my wait list opened up because I've had some clients who've worked out their system issues, and they're no longer, you know, on my regular calendar. I may see them once a month, once every 2 months or whatever. However, and because I just don't accept new clients in August. So because I don't accept new clients in August, I had a wait list. So now my wait list is opened up and I have been able to accept new clients for September. So don't be turned off if someone says they have a wait list. If that is somebody that you really want to work with, let them know, and, you know, we will get back to you. Just don't, you know, sometimes you may have to press. Like I had one couple who were like, is the wait list back open yet? And so it's like, actually it's open today. And so, you know, I was able to get them scheduled. Get the recommendation from a trusted friend or a colleague. If you are comfortable, you don't have to share why you need a therapist, but you can say, hey, you know, maybe you've heard somebody say that they have a therapist. Maybe you've heard somebody say they know somebody who's a therapist. You can always ask this question. Or you say it like this: I have a friend who's looking for a therapist. Would you know somebody? You don't have to tell me it's you. You don't have, you know, I have a friend, you know, or, you know, I have a colleague, or I heard somebody say they need a therapist, or I overheard you talking about your therapist. Tell me what you like about them. Would you recommend them to someone? There are different ways that you can request information from someone without disclosing it. You want that information from yourself, for yourself. Your medical professional. I have a relationship with several medical, I have 2 nurse practitioners and a dentist and a couple other folks, a chiropractor. It was interesting because the guy who's a chiropractor, he was just like, "Oh, you're a therapist? I'm always talking to people about their issues. I need to be able to refer them to somebody." And I was like, "Oh, well, here's my card." And he's actually referred 4 people to me, and it's been really a good relationship. I'm not able to accept all of his people, but I can at least, talk to you and see what's going on, and, maybe recommend someone else that may be better for you than me. But it's been a great type of relationship. So talk to a medical professional, talk to your doctor, talk to your OBGYN or someone who you trust who's a medical professional. And always, always verify credentials. Please verify credentials. And the way you can do that is just by going on your state's. There's a website. Each state should have a health. Maryland is like health professionals, and you can look any person who is credentialed in Maryland up by their code. We could give you, I have a license number. So you can verify credentials using a license number through your state's health advocacy network, because that's also how you report any ethical violations. So let me see if this video is going to come up. Yay. No, you didn't. This is what happens when I touch it way too many times.
You have to start sharing again.
I do. Okay, I apologize. I start getting excited. All right.
There you go.
All right. Okay. Let's see if it will. It's gonna work. Slow my roll.
Hi, I'd like to make an appointment.
Okay. Are you a new client?
Yes, I've never done this before.
Okay, that's not a problem. I'm glad you called. I have a cancellation on Monday at 3 p.m. Does that work for you?
Yes, that works for me.
Great. We'll see you then.
Wow, that was just like making an appointment at my doctor's office.
Hi, I'm here for my appointment with Claire.
Welcome. Since you're new, could you fill out this new client packet? When you're finished, bring it back to me and I'll take you back to meet your therapist.
All right, thank you.
You may feel nervous attending your first therapy appointment, as you might not know what to expect. Here is some information that may help you as you start therapy. Psychotherapy or talk therapy can help you deal with thoughts, emotions, and behaviors. It can be used to address a variety of events, such as life changes, conflict, or struggling to meet goals. There are many types of psychotherapies used today. Your therapist will work with you to assess which method will work best for your situation. Just like doctors, mental health professionals have different credentials and specialized training. Oftentimes, the term therapist can be a general term for any certified mental health professional. Don't be afraid to ask your therapist about their background and experience.
As a psychologist, I'm able to evaluate, diagnose, and provide specialized therapy.
As a licensed clinical social worker, I assess and provide psychotherapy to clients with an emphasis on community and environmental factors.
As a counselor, I provide counseling services to individuals, couples, and families.
Hi, Kamal. Since this is our first session, can you just tell me about yourself and what you would like to get out of therapy?
The first session will be for you and your therapist to get to know each other. They may ask you about your background and struggles, which can help develop a treatment plan. Throughout the process, the therapist will work with you to explore challenges, discover alternative ways of thinking, behaving, and managing your emotions. In this stage, they may use role play or assigned homework, like reading or practicing new skills, to help you discover new insights. They may also teach you how to monitor your treatment goals on your road to recovery. As you progress in each session, you can work with your therapist to determine the timing of future sessions. You can still have periodic checkups, just as you would with a medical doctor, to maintain your progress. Here are some tips to get the most out of psychotherapy.
Approach psychotherapy like a partnership. Psychotherapy is an active collaboration, and you must do your part to see results.
Help set your own treatment goals and stick to a timeline to keep you on track.
Share your feedback. If a particular session didn't seem to go well, talk it through with your therapist so the necessary changes can be made.
Changing your behavior can be difficult and you will need to practice your new skills. It's worth it to become better at handling your thoughts and behaviors in the future.
After my first session, my therapist and I decided that cognitive behavioral therapy would be best to help with my stress. We've planned for 10 sessions, but that may change depending on my treatment progress.
I was really nervous before starting therapy, but now I can see the progress I am making. Psychotherapy has really helped me work toward my goals, and it continues to teach me new skills to approach how I handle the changes in my life.
So basically that video is just trying to, like I'm saying before, we're layering, all right? So when we talk about how to get the most out of your therapy experience, one of the first questions that you may, you want to identify why you're seeking therapy, and what we call is the miracle question. So that might be the first question that, what happened? Okay.
That was me.
No worries. I was like, I hope it wasn't me. But anyway, so what we're doing is that you're identifying why you're seeking therapy in the first place. So we ask what we call the miracle question, and every single therapist has been trained on this. And basically the question is, what if you woke up one day and noticed that a miracle had happened? And you can write this down. What kind of changes would you see? And what would it mean for your life to move forward? Actively engaged within the therapy. There may be days that you have scheduled a therapy appointment and you're like, I don't even know what I'm going to talk about today. We just ask that you come ready just to be open to be in the therapeutic space. Apply insights and strategy in your everyday life. So whatever you talk to your therapist about, there should be something that you leave your therapy session with that you can start incorporating within your everyday that's going on. Manage the expectations based on your diagnosis. As you work with your clinician, you have an initial diagnosis and you start with a treatment plan. I always check in with my clients about every 3 to 4 sessions, like, okay, these are some things that you said you wanted to work on. Are we still tracking? You want to get agreement on what goals in the work that you're doing, and explore the thoughts and feelings, but also give yourself time to heal. I think at the beginning, when I was introducing and I was showing you all those pictures of all the things and that I say that who I am, and all the pictures, this is what happens, when you do social media. When you posting pictures and you're posting on social media, all you're posting is your good stuff, right? What I didn't share with you guys is that I am a sexual assault survivor, but it took me 20+ years to, number one, really recognize that that's really what it was. And number two, to own it, to be able to explore my thoughts and feelings. And I will, share with you that the hardest thing for me to do was being vulnerable enough in this space, but it was almost a forced kind of thing. So if you can imagine, I had been working with a therapist, on and off. Once I decided to walk along in this journey, but also when I was going through a divorce, and prior to that, when I returned from Iraq. When I returned from Iraq, my mom thought I was different. And I'm sure other people thought I was different too. People who knew me, but my mom was the one who said something to me. And what she said to me was, you keep pushing. I was pushing my youngest son away because he's my clinger. And if I was sitting here, he was sitting here. So I was always like pushing him away. And my mom is like, I'm noticing that you're pushing him away. You need to talk to somebody. And I was like, I'm fine. And until I wasn't fine. And when you moved the slide to go back. There, stay there. So what ended up happening was, as I was actually on this therapy journey to become a therapist, seeing a nurse practitioner who was a therapist, to work on the dissolving of my marriage and getting through that. At the same time, the Army was going through a process where they wanted everybody who was getting outside therapy, you had to then they wanted you to see military therapists. And when I went for my exit physical in 2012, and the doctor who was seeing me, a young major, she was like, oh, I noticed that you're doing therapy. And I was like, yes. And she's like, well, we have to move you to Walter Reed. You have to do your therapy at Walter Reed. And if you can imagine, you're a young major, and here's this senior lieutenant colonel curled up in a ball crying in your office because you told her she had to go to therapy with a military person versus the person that she had been seeing. I didn't realize at the time that that was actually a trigger for me, because I did not want to talk to somebody about my issues with sexual assault in a military space. And at the time, because I was an intel officer, I did not want anything in my record to show that I couldn't handle my intel job. And so I share that with you because it took me time to explore what was going on with me, to heal. It took me time to explore what was going on with me to move through that space. And I had to stay with it. I had to just continue to walk through it. Now, was this a linear journey? Absolutely not. It was an up and down. It was like I was on a mountain some days and I was in the deepest ass valleys on other days. And is it perfect today? No, it is not. However, it's manageable. It's better. I know how to work through. So when I say part of the therapy experience is learning to manage your expectations with the therapy, that is what I'm talking about. It's also about the relationship with your therapist. I had one therapist I work with where we had to quit after a couple sessions because it just wasn't working. You have to understand that there's some ethical challenges. If your therapist is crossing a boundary that you have clearly stated, that's an ethical violation. We as therapists are required to report certain things. That's to be told to you prior to your therapy appointments. It's supposed to be emotionally bond and trust. You should be able to walk in that therapy room and feel that you can share without being judged. If you feel your therapist is judging you, call them on it. The hardest thing for us to do sometimes is challenge a professional. I give my clients permission to challenge me. If I get it wrong, tell me I got it wrong. But you should be able to be comfortable enough with your clinician to say, I don't think that's correct. I'm not feeling the same thing you're feeling. I don't see that. And that's okay. It's okay. That's how we learn about who you are. That's how we learn about what's different about you versus what's different about someone else we may have seen with the same problem, same challenge. There should be some caring in that room. There should be a lot of respect and some empathy in that room. And it should also be a non-judgmental space. If you at any time feel you are being judged, I am going to say this: find another clinician, or challenge that clinician, or say, I think you're judging me. There are times when I have some of my young clients, I'll tell them, if my face does a certain thing, call me on it. I'm judging. There's sometimes I can't help myself. I've been working with you for several months, and then you take a step back, and then so there's a part of me that, because I care, I'm like, what are you doing? What's going on here? So I may challenge you on that. But if you feel that you are being treated in a way that is making you feel, so it's making you feel less than, because there's some days you're going to walk out of therapy and it's not going to be good. You're going to walk out and be like, why the hell am I even paying this chick money? Because it's just not working for me. But in those instances, that's why I said you should be able to challenge. That didn't work for me the last time. That homework you gave me did not work. I left here the last time from this therapy session still angry. I left here feeling like you didn't do anything for me. Let's talk about it. I'm open to that. If your therapist is not open to talking about how you feel, we need to find somebody else for you. Next slide. There it is. Okay. What if it's not working? Is it me? Let's ask that question first. Is it me? It could be me. It could be me not being open, not sharing, not giving you what I really need, judging you as my clinician. Are you able to do this? And it's hard for therapists to get therapy because we judging everybody. You know, are you asking me the right questions? Did you ask me this question? So it can be difficult. You can ask a therapist, maybe there's a need, we need to change the approach or the technique. Maybe I'm using a mindfulness thing on you and you're looking at me like, what the hell? I'm not a mindful chick. That's not going to work for me. Manage your expectations. A lot of times I'll start with clients and I'll say, hey, you know, what we ask is that you give us 3 months. Sometimes clients are like, 3 months, that's a long time. Well, if I see you once a week, that's 12 sessions. That's 12 hours. Is 12 hours really long enough to work on something that you've been dealing with for 20 years, for your whole life? So let's manage your expectation. Lifestyle changes. Are you going through some things in your life? Are you, I work with a lot of kids who are, going to college. This is their first time. I have a couple kids who are on the autism spectrum who are brilliant, but now this is the first time they're leaving home to go to college. We have to work on what those lifestyle changes look like. Are you doing the homework? Is the homework the therapist is giving you, is it good for you? Is it not good for you? Is the therapist not giving you homework? Let's talk about those things. Maybe you need to find a new therapist, get a clearer diagnosis, specify, what treatment goals. A lot of times, I'll have someone say, well, I didn't talk about treatment goals with my other clinician. Okay. I like to talk about treatment goals. I like to know that whatever's working is working. Whatever's not working is not working. Do we need to try something else? If you have a religious issue, if you have a non-religion issue, if you have somebody who's like overly religious and it's like, oh, I'm gonna pray for you. And you're like, I already told you I was an atheist. Why are you praying for me? Those types of things. And again, the cost, it just may be cost prohibitive for you. If it is cost prohibitive, there are other things that can be done that can help you to get through those types of things. I've had clients that I've had to let go. I had a client who I had to let go because they put me in an unethical situation. And so I had to, politely say, I can no longer treat you, because I didn't feel comfortable, number one, and I felt that the particular situation the client had put me in was going to put my license at risk. There have been clients who've told me they've ended therapy for, I don't know why they ended it. It's like, I choose not to do therapy anymore. Okay. A lot of times I work with my clients to figure out, okay, why are we in this space? Where are we going? If you're ready to end, let's just talk about what you've done well and where, I believe you still need to do work. But if you think you're great, then hey, we're going to, keep it moving. So what I'm saying here is that I want you to give yourself permission that if that therapy relationship that you're in, if you're in one, is not working, give yourself permission to find someone that will work with you. And it's okay. My feelings don't get hurt. I recognize that I'm not for everybody, and that's okay too. So next slide. So can we just launch the poll question here?
When you're ready for the video, Cassie will play the video for you.
Okay, so I want to just be cognizant of time. I know we're like at 8:05. Are there any questions? But before we start the video, because the video is about 10 minutes, and people can watch it on their own if they want. But I would like for people to have, if they have any questions that, or if there are any questions in the chat, because I can't see it.
The link to the TED Talk is also in the chat for anyone that wants to watch it on their own.
No questions in the chat just yet, Beverly.
Okay, that's perfectly fine. Okay, so how was the poll question? Okay, so do you feel better prepared to more effectively engage with your therapist, or go and seek a new therapist? Okay. So for those who said, it was 89% said yes, 2 said you need more information, well, not 2, but 11% say you need more information. So like I said, they'll put my information in the chat, my email address in the chat. And if there's anybody who wants to reach out to me, who has more questions or would like to just talk a little bit more, I am totally available to do that for this audience.
To get questions kicked off, Beverly, I have one, which was, can you give an example of a success story?
Well, one of the ones that I had most recently, I had a young man who actually tried to hurt himself in my office 4 years ago. I had been seeing him because he is on the autism spectrum. However, he is a high functioning autistic individual. And he was really dealing with a lot of bullying in school, and his mother had brought him in for a session, and he had said to me, I just think I need to die. And I'm like, okay, let's take a step back. What happened today? And he proceeds to take a pencil out of his pocket and stabbed himself in the leg. So we had called the ambulance. That's major emergency, shut down. Had to take him over to a local hospital to be seen by the psych. Had to have him admitted into the psych ward. He ended up staying for like 3 days. Then they processed him as an outpatient. And then I worked with him for another 2 years after that with his psychiatrist. Stopped seeing him maybe a year and a half ago. Felt like he was doing fine. He felt like he was doing fine. He was, playing sports. He was doing more things that someone his age should be doing. His mother called me this year and said, I want to say thank you. And I was like, wow, I haven't heard from you guys in a while. I said, I hope everything's going well. He is going to college. He is, he's just doing phenomenal, she said, based, you know, after all the stuff that we went through with him, she was just really thankful that get him out of high school and wanted to share with me that he is going to college and that he was a success. So that is something that definitely resonated with me because it's the first person I ever had to go to the hospital with in that type of a situation, and to see that it worked well. So that was, that's an example of a success story. And I have several, but you know, that's the one that resonates with me right now. So thank you for asking. And I just want to say that there could be a situation where you don't think therapy is a good option for you right now. Maybe you're not ready to dig deep. It's okay. It's okay. What I will say is that the thing that I have learned the most along this journey, and as I have learned more about the sexual trauma within the sex therapy space, is that sometimes it is helpful to share the experience, because when we try to bury the experience, it becomes almost like it's exponential, and it just still stays there. And if you've ever read a book called The Body Keeps Score, you may see that there's some alignment and how, you know, we're sick, there's sicknesses and things like that when we keep things that are held, especially traumatic experiences that we keep inside. So I would say, if you don't feel therapy is a good option for you now, that's okay. But if you at some point in time do feel that you want to talk about it, or that there's something that you want to do, work with someone who is experienced with sexual trauma, because then you'll have someone who has some empathy. And I will also say that while everybody's VA experience is not the same, my encouragement to anyone who experienced any type of sexual assault while you were on active duty, while you were in your cadet status, whatever, file a claim. It may be difficult. You are going to have to share your story with a medical clinician. However, file that claim. And if you think that you're not sure about how to do it, reach out to someone who may have done it before. Reach out to me. I filed a claim, and I'm at pretty much 80% PTSD disability because of it. So I want to encourage you to reach out, and if that is something that has happened to you, or you know someone. But also, like I said before, I am available. I'm going to encourage everybody to watch Emily's TED Talk, because it's a little bit of experience about just, you know, why she thought that she should go to therapy and why we all should try it. So that's all I have for today. And I just want to say thank you to each one of you for being here, and just for your presence, and for just being the unicorns that you are. So thank you.
Hey, from the chat, we've got a question. What is the benefit of filing a claim for sexual assault?
You could potentially, when you file a claim, you could potentially get payment or treatment. You could potentially get treatment by the VA, which gives you access to clinicians. It's not perfect. Let me be very clear. It is not a perfect system. And you can get, you can get a VA disability claim. You can have a disability thing that you're getting a disability payment, and, you know, based on whatever issue that you may have, it may be $100, it may be $1,000, I don't know. But that is the benefit of getting, filing a VA claim, is that you could potentially get paid for your trauma, and you can get seen and get help within the VA. And that way, if you're struggling with paying a clinician, then you can, you file a claim and they say, okay, yes, you can get seen at the VA, then you go to the VA for treatment.
One more question from the chat. I'm going to read it word for word. Thank you, Beverly. This has been very insightful, amazing talk. Is crying a good outcome of therapy? My first therapy, every call led to tears. I believe it was cathartic, but it was tough. A lot of digging and uncovering self-revelation. What are your thoughts on some people being more sensitive to others? Any thoughts?
I was crying on the plane yesterday after reading a book. I think crying is good if it is good for you. If you're not a crier, you're not a crier. But if you're a crier and you're crying in therapy, do what you need to do to get that. Some people need to yell in therapy. Some people need to scream. And the room should be available for you to do that. But don't feel ashamed of your tears. If it's cathartic and it's helping, let them flow. It's when you try to hold it in, because what ends up happening is, I don't want to be seen as weak because I'm crying. Because that's what we're taught at the academy, right? Oh, you crying, you're weak. Oh, you're this, you're weak. Or you're that. You don't deserve. You're not a good leader. People don't do this. Well, yes, they do. Yes, they do. And so if your therapy room is a safe enough space for you to feel you can let go and cry, do what you need to do. Every therapist should have a box of tissues at ready. And then we're going to explore where the tears came from.
All right, Beverly, I have another question for you, which is, how can therapy assist in improving my communication skills?
Sometimes we have to learn how we approach things. I'm a very direct kind of person, and I will say this. Therapy helped me see where my husband, I'm just very direct, and I'm like, well, okay, well, what's wrong with X, Y, and Z? But he was receiving it as an attack. And so sometimes with the therapy space, having somebody else in the room to help you walk through some challenges that you may be having is one way to, help you see how you're communicating, and help you see that maybe you could say it differently. It's one thing that I'm working on now is how I approach a couple of my relatives who are irritating me in the moment. And so what I'm working on is how, and the irritation is that, of course you get mad because they're not doing what you think they should be doing. And so no matter what I say, they're still doing the same thing. So my therapist is working with me on my approach. And so helping me to see that it's not about me, it's about, helping them, allowing them, let me say that, to do the thing that they're going to do and understanding why it's upsetting to me so much. So that's how communication therapy can help you to improve your communication, because sometimes we just want it to be the way we want it to be. And my therapist is helping me understand that it's not always about what I want. And, how do I go about approaching it that way? And how do I not hold a grudge against the person who I think should be doing something different, but allowing them to be who they are, as long as it's not hurting them. So. Thank you.
All right. Thank you, Beverly. We have time for a few more questions. Please put them in the chat or raise your hand to be called on. If we don't see anything pop up shortly, we will wrap up the event. Oh, Jackie has a question. Jackie.
Sorry if we're going to end it. I feel like when I have an appointment, it's always a good day. And then I never know what to talk about. And then we end up just kind of staring and doing the small talk. I try and write notes on my phone on the bad days just for content to bring up, but do you have any ideas to help that situation?
Yeah, I think, writing the thoughts down. Thank you for that question, Jackie. Writing your thoughts down is definitely a way to help because you're bringing something in. You may have forgotten it, right? Because yes, you're having a great day, but you forgot about this other thing that happened that you want to process. So I do encourage my clients to kind of keep a journal of things that they want to work on in therapy. However, if you came to my therapy practice and you were like, oh, I can't remember, everything's great, then I'll go through your treatment plan. And I'm like, okay, well, we said we were going to start working on X, Y, and Z. So let's talk about X. During our last session, you had mentioned this. How is that going? And I bring up your treatment goals because then I'm like, okay, well, do we need to talk? Is there something else that we need to work on? Or is there something else that we need to adjust? Is this over? Are you solved or whatever? So if it feels like it's dead space, there's some clinicians who believe you're going to come up with your own question to ask or whatever. I'm just like, okay, you don't have anything to talk about. Let's go back to the treatment goals. So that's just one way of doing it. But I do think that what you're doing right now by keep taking your notes is important. Just take your notes with you to therapy.
Awesome. Thanks, Beverly.
Thank you.
All right, well, I have one last question for you, and then we'll close up. Are there any situations where therapy may not be the best option?
I would say if you are it's a sense of urgency, right? So if you're in an abusive relationship, you may need to go through therapy to help you make that step, right? To get out of that situation. However, you may need to get out of that situation first before you may have to get out of a situation. I don't think that there's actually no reason there's where it's not the best option. I think sometimes it has to be combined with psychiatry, with medication, to help you to get the best outcome from the therapy experience. There's some things that we deal with that you may need medication along with therapy to get the best result. I am not saying you have to take medication, but I'm saying it may be an option. And now, and many of us who came up in the non-marijuana stages, there are other ways of getting, you don't have to have medication. You can have medical marijuana, you can have other treatments, acupuncture. There are different types of treatments out here, holistic treatments that are available to you, along with the talk therapy that may help. So I would say explore alternative treatment options along with therapy. But if you are in a situation where you are in harm, let's not go to therapy to get out of the harmful situation. Let's get out of the harmful situation, and then let's get to therapy to figure out how we can not be in that situation again.
Well, thank you, Beverly. I don't see any more questions. Mary Kate, are there any more in the chat?
No, nothing in the chat, but Beverly, just to let you know, we just shared your email with someone who asked.
Mm-hmm.
Oh, sorry, one just popped up. What is your opinion on therapy at the VA versus the vet center for MST?
Like I said before, where you're comfortable. I don't think it matters where you get it. It's where you're comfortable. If you're comfortable with the VA therapist that you're seeing, stay there. If you're comfortable at the MST center that you're at, stay there. If you're not comfortable with either of those situations, there's, in the last slide I had in there, there's a probonotherapy.com if you can't afford it. Go on Psychology Today to try to find a therapist. The RAIN network has people who are there to talk to you. So my thing is whoever is helping you to heal is where you go and where you stay. If that person is helping you to heal, I don't care if they're VA, MST, whoever, they're helping you to heal. That is what's important.
Thank you, Beverly, for spending your evening with us and sharing such powerful information. To all of you who joined us tonight, thank you for trusting us to help you along your healing journey. The entire group coordinating this event is so grateful to have the opportunity to be creating this network of amazing people to help heal our past traumas and help prevent future assaults through education. If you find yourself triggered, anxious, angry, emotional, or any combination of those feelings as you process tonight's discussion, please know it is often a very normal response and part of the healing process. Do not hesitate to reach out to the National Mental Health 24/7 hotline at 988 or via text at 838-255. You can also consult the resource list linked in the chat, as well as email Aletha Williams, our volunteer therapist, for the evening. Her information is being put into the chat. Hold on,